It's been a couple of weeks since the 92nd Street Y event with Chrissy Teigen, and I've had time to really sit with the stories I've heard that day. It was a great event with an important discussion driven by Dr. Bellini. But for me, one thought keeps rising to the top. The way we start the type 1 diabetes journey matters. As a pediatrician and as a mom myself, it hit home to hear Chrissy speaking not as a celebrity, but as a mom sharing her experiences navigating her son's T1D diagnosis. This is where our role as HCPs really matters, because for about 1 in 3 kids, the story of type 1 diabetes starts in the emergency room. The thing is, we already have tools that can help shift the story from crisis to action. With autoantibody screening, we can identify at-risk children before they end up in DKA at the hospital. Chapter 1. Who should be screened? Consider recommending T1D autoantibody screening for anyone with a family history of T1D, autoimmune conditions like thyroid disease or celiac disease, early signs like hyperglycemia, unintentional weight loss, or other classic symptoms of T1D. Annual wellness visits, follow-ups for autoimmune diagnosis, or appointments to discuss concerns over other metabolic symptoms are all opportunities to discuss T1D screening with at-risk patients. Chapter 2. How to screen. With a simple blood test, we can screen for 4 key autoantibodies, markers that indicate that the immune system is attacking the beta cells in the pancreas. The presence of 2 or more autoantibodies can indicate T1D, sometimes years before any symptoms emerge. Here's how I teach it. 4, 2, 1. Follow ADA recommendations and test for 4 autoantibodies. If 2 or more are positive, that's a sign of stage 1 or stage 2 type 1 diabetes, depending on glycemic levels. Chapter 3. What happens next? If a child screens positive for T1D autoantibodies, we don't panic, we plan. Schedule follow-ups and refer to a specialist. This process doesn't have to take months. Encourage the family to begin close glucose monitoring or connect with the advocacy organizations that are available to support patients with T1D. Offer emotional support and education. There are so many ways to help patients gain the tools and skills they need to manage T1D. A positive autoantibody screen result isn't just a step in the diagnosis, it's also a chance to prepare. And that's the message I'm taking with me, that with early action, we can help prepare families to face this journey with knowledge, not fear. Together, we can help to rewrite how the story starts for those at risk for T1D. I've been engaged by Sanofi to highlight the importance of taking action to screen for T1D autoantibodies, what we can do to support patients who may be at risk, and when to advocate for them. Check out betawayt1d.com to learn more and get screened.